So this is a 40 years old male who has visited the doctor because he was feeling bad lately for the past 3 months, and he was having problem in falling asleep and no desire to go out, and he has stopped going out to play baseball with friends, and he's having obesity, and he has no spouse, no children, and he's having difficulty finding a date. He's feeling worthlessness, and he has even missed the days at work, and he's finding it difficult to concentrate on the work. So which of the following is the most important question to ask at this point? So take a pause and think of a likely answer at this point. So the option B is the correct answer because this patient is at risk of committing suicide because this patient fulfills the criteria of SIG caps, the nine parameters on which you basically measure the risk of a major depressive disorder. And if the out of nine, five criteria is met, you label the patient as patient suffering from major depressive disorder. So this patient fulfills the criteria, and this patient is suffering from major depressive disorder. So after labeling the patient, after diagnosing the patient, you have to identify the risk factor for this patient, if this patient is going to commit suicide or not. So the first and foremost step is you have to evaluate the patient risk of committing suicide, and it is so important that you can ask a leading or direct question at this time. Most of the time you don't ask a leading or direct question in the most of the ethical or communication style questions, and you're not going to ask. But at this question, because the patient is going to suffer if you don't ask this question, and if you don't evaluate the patient by asking a direct question, so you can just ignore this rule and you can ask a leading or direct question at this point. So this is a perfect example where you can ask a direct question. Option A, asking about the recent stressors in the life. First of all, it is a leading and a direct question. You're not going to ask a leading and direct question. And secondly, asking about the feeling of committing suicide is more important than to evaluate any recent stressor. You can evaluate the recent stressor later on, but first of all you have to evaluate the most important and most concerning thing, which is the risk of committing suicide. Option C is about dating. So you can ask this question later on, and it is not the most distressing issue at the moment. Option D, it can jeopardize the professional boundaries, and you have to maintain the professional boundaries with the patient. And if you breach the doctor patient boundary, so it is going to be against the medical ethics guideline. Furthermore, it is not going to help the patient in the current scenario. So it is a wrong answer.